Okay, it's good. Ansley Bevan, with over 131,000 followers on Instagram, your success as an online wellness academy, holding retreats around the world and speaking at international events. I'm realized that you're someone who's not afraid to speak up for our four-legged friends. And I'm just curious, like, where did this all start for you?
Thank you. That's quite a intro. Well, I would say, I feel my beginnings with everything in the horse world are fairly humble and unextraordinary. Um, Being a horse girl since I was kind of young, um, you're only exposed to what you're exposed to, right? So there's a certain way of doing things. You don't really ask a lot of questions when you're kind of a child or a teenager riding, and you just listen to your trainer and your peers around you. I actually didn't own my first horse until my late 20s. So while I was involved with horses, I really I wasn't hands-on every day with them doing everything. So my knowledge only went so far. Um, so as I kind of bridged the gap into the horse world a little bit more, my career as a licensed massage therapist for humans, I always sort of kept that private from horses. I didn't really want to blend the two because horses were a passion and a hobby, and I didn't want to make it work. So I sort of resisted blending those two things together for a long time, and then eventually they did meld together, and that's sort of how I transitioned into working on horses was primarily through massage therapy and body work. And I quickly found that there were more deep rooted problems that I couldn't solve with just hands on therapy. And I learned that due to a couple horses that I had more or less as case studies, and then also my own horse. I started going down a rabbit hole of seeing chronic injuries that just kept reoccurring, seeing behavioral problems in the horses, and really trying to dig deep on why these things were showing up and why we couldn't get rid of them. And I found, lifestyle is a big part of this. The rehabilitation process is a big part of this. How they're ridden and trained and managed. So there's only so many things you can do as a practitioner, whether you're a body worker, acupuncture, chiro, veterinarian, osteo, any of those things. There's only so many things you can do and affect change because it's really a whole cycle. It's a whole puzzle, right? Because you have to be able to mediate everything else to see true change. So I would say that's kind of how my world with horses got a little bit bigger than just riding and enthusiast and massage therapy and body work. It really sort of spiraled into, hoof care and tack and bitless and lifestyle and turnout and what are all these other things going on in nutrition. So I guess long story short, that sort of explains the curiosity that started it all for me. And I can certainly go into a little bit more of, my own personal horse and some of the problems I was seeing with him or some of those horses close to me if you're interested in hearing.
Yeah, selfishly, I resonate so much, especially with you saying like we start off as practitioners, and I'd love to know when you decided to cross both under, like you were like, no, I'm going to keep the humans separate to the horses, and
Mm.
want to keep, I totally get that. But it's almost like and I'd love to hear your take on this. The more I know about horses, the more I realize I don't know. And the more
Hmm.
I'm like, okay, we have this qualification and you have your standard of care and almost like your golden tick box to say you're safe to treat, but it doesn't mean you have the answers at all. And if anything, the more you kind of know about anatomy, the more, again, I'd love to know your take, the more I realize is, oh my God, like there is so much I don't know and need to know that cover this holistic aspect as well to horse.
Yeah. Yeah, no, I absolutely agree. And I think that that really defines what makes a practitioner great versus maybe one who's just good is knowing that there's always something more for you to learn and that you don't know it all and that you just have to keep immersing yourself into different continuing education, different views, different case studies, get your hands on different horses, be in different regions, because you don't know it all. And the horse is just like this teacher of eternity because there's never you're never going to run out of things to learn from them or things to see. And to speak to that a little further, there were some beliefs or mentalities I had maybe 3 years ago about horses that no longer hold true for me, about their physical bodies or capability or pain, just based on the things I've learned in the last few years, the things I've seen horses go through, and specifically attending an equine dissection. Last fall, I did that, and that was truly mind-blowing to see, and almost reaffirming to see these things going on internally that come out in behavior and performance. Because I think a lot of times in the performance world, we really see just like a straightforward black and white answer. Okay, the horse is doing this, so we're going to inject this. The horse is doing this, so this is what you need to do for training. The horse is doing this, and just a very singular, straightforward rehab that really isn't invasive enough and demanding enough or dynamic enough. And it's the truth is that's just not the case. I mean, there's so many things that we can't see in imaging that you can only see, post-mortem. And I really think that the people that are diving in and doing this dissection work, I mean, that's where the answers lie. Because do we really have the capability to say, hey, this is fused, this means there's no pain? Because that's what you'll hear all the time in the practitioner world. I'm sure you have as well. But can you truly say that? Because when you pick the body apart post-mortem and we're really seeing the expanse of what the body has done to protect itself over time, I mean, it's truly mind-blowing. And you're sitting here saying, wow, this horse ended up doing XYZ its whole life, and this is what it looked like on the inside. I mean, it's pretty crazy.
Oh yeah, I'd love to know more about those beliefs that you've kind of busted for yourself and realized that okay, that doesn't serve me anymore. Because A, that's important as from a growth perspective, but B, it's like
Hmm.
you'll give listeners as well that it's okay to be wrong. And I think that is
Yeah.
something that's not often spoken about, even as a therapist going out there, like we're not right all the time. We try and be based on our knowledge, experience of anatomy and what we see. But it's okay to also be wrong. We're human.
Yeah. Yeah. No, I mean, you're absolutely correct. And I think one of the things for me, when I first started my journey with like exploring how I felt about horseshoes, traditional metal shoes versus barefoot, and some of those alternative options, when I first started going down that rabbit hole, I really truly thought, okay, every horse can go barefoot. This is how nature intended. This is how it should be. And while I still primarily feel that way, I've let off a little bit in terms of, hey, listen, I think that if a horse does need an alternative shoe, or a boot or something like that, then there are some horses that are just environmentally, and maybe a little bit genetically, they are just not going to be able to be as hardy as, let's say, for example, a horse who lives in an extremely wet climate, who doesn't have access to any hard terrain or varied terrain for the majority of the year. Their hooves, despite everything that you can do, they're not going to be as weathered as a horse who has access to hard terrain, rocks, hills. You know what I mean? It's just they're environmentally, there's only so much you can do. You can assimilate those things the best you can in track systems and things like that. But I've come to learn that environment is a huge factor, lifestyle is a huge factor. There are other boxes that need to be checked for the horse to be successfully barefoot. And so, yeah, I've let off a little bit from this very extreme, they should all be able to go barefoot. Because the truth is, like, some of them, they do need outside assistance if you can't, mitigate all those other boxes that need to be checked, like environment, diet, lifestyle, those types of things. So for one, I would say that's something, a belief that has truly shifted over time. And I think another thing is really truly ruling out pain for the horse. And I don't know that I ever 100% believed that, hey, we can say the horse is not in pain because they can't speak to us. They can only show us, right? And a lot of times you will get a stoic horse or a shutdown horse. But, I think that I sort of have fallen into the trap sometimes of just believing the higher up opinion. So if the vet is telling you, hey, they're not in pain, we've done all the imaging, we've done all the flexions, and we can see in the rads that there's fusion there, this, that, and the other. So they're not in pain. I don't believe that. I don't believe we can say that. And that's not to cast this overbearing negativity of your horse might always be in pain, so you can't. I don't want anybody to walk away carrying that kind of anxiety with them. It's just an observation from a practitioner standpoint that I think there are things that we cannot see within the body, and I don't think we can ever be certain what level of comfort the horse has learned to regulate themselves at, if that makes sense.
Totally. And also we know, like I always try and explain to both the horse and the horse's owners, that our bodies are always adapting to what's in front of us for the day. And some days, depending
Mhm.
on how we've slept, depending on what happened in the barn or what happened to us, like we're going to have a different day to yesterday or the next day. And that goes into that, which I know you're very much an advocate for, of horse behavior. But I just want to go back to that point about, when you can't really ever say, is a horse pain free? And resonate with that on so many levels. Where I find it's a bit tricky, and I've worked with a lot of owners like this and clients, and people message me and they say, well, we found these patterns which keep recurring from the body perspective, posture, from a movement perspective. We've tried ABC corrective work, but we've also had confirmed x-rays to say that everything is clear. So surely the horse must, there's the horse cannot be in pain enough to push it through it. And just again, thinking very personally, this is something I find at the moment very hard to almost communicate, because we were part of a team here in the UK. The vets do have the final say.
Mhm.
However, again, not to be doom and gloom on vets, because there's some fantastic vets out there, as they are practitioners. There has to be, at the end of the day, someone who has the final say. But I do find it a very conflicting and very like I'm walking on tender hooks. And I find my owners that come to me as new or existing will say, well, where do we go from here? Because if we're only following the x-ray, but my horse is showing me this, where do we go? So I have my answer to it, but I'd love to know yours.
Yeah, that's kind of exactly what I'm talking about. And I think the only way I tend to be a little bit where I am in my practice now, I do tend to be a little bit more straightforward and blunt, because I feel, that that's my ethos, right? So I think that you just have to be truthful with them and say, it's just like if a human walked in and said, "Hey, we've done the rads and we can't see anything," what would the next step be? Your symptoms are still there. You're still trying to explain that you're uncomfortable or whatever your ailment or issue is. So the next thing would be more diagnostics. Well, the fact of the matter is, we don't have as many diagnostic tools when it comes to equine health as we do with human health. So I think we have to kind of bridge that gap for owners and for the lay person to understand that while yes, we can see some things, we can do our best with an animal that can't verbalize truly what's going on. We have our set of imaging and our set of tools and flexions and nerve blocks and whatever the case may be. But at the end of the day, there are things that we can't see. So whether that's internal, inside the intricacies of a joint, or if it's, too deep to be imaged, or if it's within an organ or something like that. I mean, that's not going to be something that we can see. So I think just being as truthful and transparent as possible to bridge that gap in their mind, because I think a lot of times for the lay person, they just think, okay, well, we've done all this imaging, we've done all this stuff. It's very straightforward, right? It's like 1, 2, 3, like 2 + 2 = 4. That's what it is. It's the same scenario you walk into every time, but it's not as black and white as that. And I think that's what needs to be communicated. Because, if you're not in the industry, it's as a practitioner, as a professional, I think it can be hard for you to understand that, if it
Yeah,
makes,
for
yeah.
sure. And I don't know if you will definitely go into your wellness academy and your retreats and things like that. And however, I try and navigate it with my owners, and I'll say we just got to keep asking questions, because if we don't ask the questions, who will? Because if you're getting
Yeah.
a straight answer from the x-ray, and I know there's a lot more people now talking about we don't ride the x-ray, we ride the body of the horse and all this. But at the end of the day, it's most owners, I always say to them, you know your horse better than anyone because you see them every day. I mean, we come in depending on what needs doing every six, maybe 3 to 6 months, you know your horse better than anyone. And if you've seen that change in the behavior, or despite things being injected or despite things being x-rayed, if you see the changes in the behavior, you've just got to keep going. You got to keep asking questions. And again, I also think to myself, like, I question my own advice, because I'll say, people want answers. Our brain wants that comfort of, okay, it is the hocks. It's almost like it's like the relief. It's like something's come up on the x-ray, and then, you almost have that little voice going, but why? Why is it the hocks? What else? And that is definitely where I can see a good change in the industry happening, as people are starting to ask questions. But it's definitely something I always advocate. It's just, you got to keep asking why, and never ever settle. If your horse is still showing you those changes in the behavior, keep going. Just keep going. Um, you will get to the answer.
Yeah, I would agree with that wholeheartedly. I think that, there are a lot of great veterinarians out there that will, carve for the court, will stay on it, and they will try, and they will be diligent and listen to the owners, and they will keep doing things. And then I think that, there's the alternative to that. There are some that sort of shut the owners down, and we've done everything, and you've got to push them through it, and they just need more riding, and this, that, and the next thing. So, and that's the same with everyone. It's not just veterinarians. I mean, body workers, farriers, whoever the case may be, there's a whole realm of the good, bad, and the ugly when it comes to that. And I think that's why I'm so big on empowering the owner, because if you have the knowledge, then one, you'll trust yourself a little bit more instinctually, like, hey, let me be an advocate for the horse because I know my horse and I know something isn't wrong. And then two, you'll know enough to help choose between, hey, I don't think this practitioner is best for me and my horse. I don't think their truths are aligned with where I want to go, or I don't know that they're as educated as I need them to be, or whatever the case may be. It'll help you be a little bit more selective in making those decisions. And I know that there are some horse owners and horse people who want to be a little bit more hands off. They don't want to have to know all these things, and that's fine. That's their prerogative. But I know there's a whole group, a large percentage of us out there that feel lost, and we want the direction, we want the help, we want to be able to do more and know more, and that's where the knowledge really comes into play. And I'm not saying you need to go to school to become this, that, and the other, but there are a few very basic foundational things that if you have in your arsenal as a horse owner, a rider, hobby, amateur, whoever you are, that will really take you very, very far with your horse in terms of soundness and longevity.
Yeah, for sure. And I'd love to ask, you mentioned it earlier, is there a specific horse that's kind of took you down this rabbit hole, or a client's horse? You mentioned that, I think you said a couple of your horses that you kind of, was this the transition from the humans into the animals and combining both? Was it?
Um, No, so the transition of the work of combining, kind of transitioning into working on horses, that happened prior. So that happened before really wanting to kind of expand my knowledge and being practitioner and getting more education surrounding things. So I bridged the gap. I started working on horses, and as these things came up, I was very much like, by nature, I'm kind of a problem solver. I don't really like to be wrong. I want an answer, and I'm very curious about the process. I want to know the process of things. I'm skeptical. I ask a lot of questions. Like, that's just the way that I learn. So I did a lot of shadowing with veterinarians, just like doing ride-along, seeing what they experience in their day-to-day life, how they mitigate, how they problem solve, cause and effect. And same thing with the farriers and barefoot trimmers, really kind of observing and seeing what's going on here. And I would say what sort of launched me to the next level was my horse Charlie. And the first thing that sort of happened with him, he started having different behavior. So it was primarily under saddle. He started refusing fences, which was very abnormal for him. And I would say, this is something's not right. So, the trainer would ride him, kind of ride around and say, oh, he feels fine to me, blah, blah, blah. And we did a couple lameness evals and nothing would come up. Or if it did come up, it was very inconsistent, barely sort of noticeable. So, we really didn't have any answers. But I knew, because like we discussed, he's my horse. At this point, we were fairly new in our relationship together. I would say I probably had him maybe a year at this point. So I was new into my journey with him and knowing him, but I just felt, I said, this isn't right. This isn't him. He's so gung ho. He's a go-getter. So clearly something's wrong. And the straw that broke the camel's back, where I sort of really pulled all authority away from these figures that I really sort of put on a pedestal, like the trainer in the barn that I was at, was he was in a training ride. Because of course I looked to myself. I said, I'm the problem. I'm just having a problem riding him, right? Like maybe it's me. So I had the trainer ride him and he went around a jump course with him. And of course, Charlie's refusing the fences. And he proceeded to take the dressage whip and just really harp on him with it. And he ended up crashing through a couple fences because he knew he was going to get beat if he stopped. So he ended up kind of taking down, I mean, they weren't high, but still, and it was very traumatic. And I walked away in tears and I was like, never again. Like I felt ashamed that I let it happen. And I was like, we're done with this. I'm taking it into my own hands and something's not right with my horse. This guy's not going to ride him anymore. We're done. We're done with that. And so, it took a lot to get me there to that absolute mindset. And I still feel bad about it to this day that I didn't, stop, like run into the arena or do something. But it's like, what are you going to do? This is a figure of authority and you respect them. And, you're in this very kind of tapered environment. So anyways, to sort of get to the next part of the story, we did end up finding out that he had some desmitis in the suspensory ligament, in the medial branch. And so because it was only desmitis, so only irritation, and it was just one branch, it was pretty hard to find, right? And another part of this story is I ended up switching veterinarians along the way as well, because previously I was using the veterinarian that the barn recommended. And so like I said, at this point, I had taken authority in my own hands. I'm like, I'm using someone else. I'm getting an answer because I know that this is not right. So anyways, that's what we ended up finding. And then that was kind of the first thing. That was the tip of the iceberg, right? So we were doing our rehab with that, which again raised some flags for me because the rehab protocol was 30-day stall rest and then hand walk, tack walk, and then just kind of gradually build up to the what you're doing before. And so he's in the stall for 30 days. And mind you, this is I think at the time he was 5 or maybe 6, off the track thoroughbred. So things were not going smoothly. And just from an emotional standpoint, I felt, wow, this is terrible. He is locked in a cement stall, like cage essentially. And I just, I felt for him. He looked like he was going to jump out of the window, like he was crawling out of his own skin. So by the time we got to our hand walk stage, it was actually quite dangerous. And I told the vet, I said, I can't ask a groom to walk him. I don't feel safe walking him. What am I supposed to do? It was like flying a kite. Like he was not, mentally, he's having a problem now. So not only was he having a physical problem, now he's got a mental problem that I feel bad that I've put on him. So she's essentially, give him some ACE and walk him. So to calm him down. So now I'm having to drug my horse to hand walk him after he's been locked in a stall for 30 days. And to a lot of people, maybe this sounds like I'm being too sensitive or too soft, because this is the straight protocol, right? I'm sure many people who are listening have had to do the same thing with their horse and maybe even more than one time. This is very normal in our industry. It didn't feel normal to me. And I still to this day stand by that. I don't agree with that being the rehab protocol. I just don't. So without taking all day to sort of keep explaining the story, more or less, the rehab didn't sit right with me. And the desmitis ended up popping back up over time a few times, even though the workload was still small. So it raised some questions in my eyes about, okay, where is this stemming from? Like physically, what's going on with the horse? And that sort of launched me into the hoof care, right? So I started exploring some barefoot options. How do the horseshoes affect the horse's proprioception or the balance or what's going on here. I started getting into just self-teaching myself about the feet. I saw, okay, he's got some contraction in the feet. I started taking pictures of his feet, just over time watching the shoeing cycles, seeing what was going on. I'm like, okay, well, maybe there's some balance issues. He doesn't have a well-developed heel or digital cushion that can affect the way the tendons and ligaments function in the feet. So that he was the one who started it all, long story short. And then, like I said, rehabbing this, the rehab never sat right with me. And later on, I ended up discovering that he had hissing spine and perhaps an old fracture through the withers. And that was something I had to fight tooth and nail for as well. And, because it was, hey, he's not really a candidate for surgery in terms of kissing spine because it wasn't severe. But I'm like, okay, well, so what do you want me to do? You just want me to get on him and ride him again? You want me to just inject and ride and that's it? And I thought this doesn't make any sense, if you compare it, because I come from the human world, you have to remember that. My mom's a physical therapist. I'm a massage therapist. If someone comes to me and says, I have chronic back pain, I'm not just going to work on you and send you on your way. I'm going to ask, what are you doing in your life? Do you work on strengthening? Are you sitting at a desk all day? What's your nutrition? What's your lifestyle? Are you stretching? I'm going to ask you all those things. So like I said, it never sat right with me that we're just one and doneing the scenario and that there wasn't a true answer. So that's when I started digging into if there were programs or what I could do for him. And I ended up doing a rehab certification down at the Animal Institute in South Florida. So I got certified in equine rehabilitation. And I will say, although that course didn't check every box for me answer-wise, it really expanded how I view things. And it was really affirming to know that there was more to the story than what you get from just as a lay person, you know what I mean? From like the veterinarian to the lay person, and there are more steps in between. And I think it's very regional, right? So South Florida is very competitive. A lot of, six-figure horses and above, Grand Prix riders, a lot of that. And then you have more rural areas where the protocol for things is very, very different. So in South Florida, they might offer regenerative injections such as PRP, platelet-rich plasma, whereas somewhere else, maybe it's just steroidal. So it varies like that, and it varies in a lot of senses. Maybe there will be more physio protocol somewhere where they have more performance horses versus somewhere where they don't. Just like the quality of care, perhaps you have a farrier or a trimmer who's amazing somewhere where there's performance horses and a lot more money and status and all of that, whereas somewhere more rural. So there's a lot of things to keep in mind, I think, when it comes to the care for your horse and what you're considering. I feel like I've gone on a bit of a tangent, so I apologize. But long story short, Charlie was the one who was kind of, I wouldn't say overly problematic, but he really opened my eyes to a lot of things. And I don't think I'd be where I am in my practice today if it wasn't for him. Because, like I said, although they weren't huge problems, they piqued my interest. And I think because of who I am by nature, like problem solver, want to know the process, need the answer, investigative, very observant, like it sparked something within me. And that's what sort of started the journey of this is a holistic process, if that makes sense.
Oh yeah, it's always good to, because there's always a horse or a dog or an experience that really makes us deep dive. And I think I know the answer to this, but I'm gonna ask you because I ask a lot of my I tend to attract owners and horse lovers that are genuinely in it for the long run. We're not in it for the quick fix. We are almost in the rabbit hole. We know there's not a quick fix. We want to know more. So it's that kind of audience I'm talking to. But would you, because I'm guessing the experience with Charlie was, you said, very emotional, seeing what he went through with the trainer, resonate with that as well. There's so many times I can even think in the last 5 years of myself, but also I've had owners on the phone crying to me saying, well, I've just been shut down. I've just been told that there's nothing wrong and I have to beat him through it. I just have to use more force or use a new gadget or use this. And it's heartbreaking to hear because it's almost like I'm a very small person. I'm about 5'2", and then I almost sometimes think, what would things be different if I was about 6'5", going in, going no. But I always tell my owners, like, remove yourself from that situation, change your team, and keep asking questions. So it's very similar. But why do you think we do it as horse lovers? Like you came into this in your 20s, you said, so not, like why do we put ourselves through this like sacrifice, the pain, the financial thing that goes into it as well? I'm talking about when you were with Charlie in the early days when it was like,
Mhm.
okay, rehab him, now this and now this. And I always ask myself, we do it, but why do you think we do it? Why do you think we sacrifice so much to speak up for these animals?
I think that there's just something innately ingrained within horse people, the ones who do it for the horse and not just for the sport. That's primarily who I'm talking about. I think that you just can't help it. It's something you can't switch off,
Mhm.
um, which makes us probably a little bit unhinged in a way. But yeah, I mean, like you had referenced, I didn't own my own horse till I was in my late 20s, but I mean, I've been a horse person my whole life and it just never went away. I mean, borderline obsession, I guess. I remember thinking when I was younger, if I could just do something with horses or have a job with horses, I'd be happy for the rest of my life. I remember thinking that, and especially when I was somewhat miserable at my corporate job, working on people. But so yeah, I think that we just have, I don't know, maybe one day they'll do studies and they'll find out there's a genetic component to horse people that we have some, I don't know. I don't know what a predisposition. I'm not sure what it is, but yeah, I think that just, and I think truly the horse as well, there is a level of just energy, or I don't even know what to call it, magic, if you will, that makes them such a truly spiritual and pure being. So I think yeah, I think a lot of us just have this very like addicted attraction to them. And, we will spend our last dime and we'll do something for the horse before we'll do it for ourselves and all of that. And maybe it is a little bit too, like there's something within the human that as a caretaker you want to fulfill. I mean, I don't know. Like that would be more of a guess, I suppose.
I think there'll be studies out there because I'm just fascinated by this. And the older I get and the more I'm in this industry, I'm like, oh my gosh, there's just something about a horse, a pony that lights me up. Like I can be in a really just weird mood or things just not going the way, and then I can see a horse, and not even my horse, and I'll be like, oh my God, like it's like something in me comes alive. And I just wonder then when we see an animal in pain or we see the behavior and we know it's pain, but we can't maybe verbalize it, it's like something lights up for us to just solve it. We need to figure it out what the answer is. Just a kind of yeah, question off there. So I actually would love to ask you, you talk about top line a lot, and I've gone through a lot of your posts, especially in the early days when you were, I loved all the visuals you had about like displaying poor top line. Top line is, again, can mean different things to different people. So how do you define the top line of a horse for someone who's listening?
Yeah, so you're correct, and I would agree that top line does mean different things to different people. For me, when I refer to the top line, it's not just the saddle support area. I know we generically refer to top line as the horse's back. In my assessment of a top line, include a little bit more surface area. So I will include at the base of the neck into the withers, going through that thoracic region into the saddle support area, and then that thoracolumbar. And I will even include the gluteals as part of that as well, because the longissimus dorsi muscle is interdigitated with the gluteal musculature. So they're literally connected. So if you have a problem with the back and that longissimus musculature, those epaxial muscles running through saddle support, you're going to see a residual effect within the gluteals. So, and I mean, just in my practice, I'm sure in yours as well. I mean, I see there's more than one indication that you have a dysfunctional top line or top line failure. It's not just, hey, this is where your saddle's sitting and it doesn't look great. I mean, it's the whole thing,
Hmm.
if that makes sense. Top line has definitely been a little bit of a, I will say, like a buzzword, not in a negative way, lately. And I think it's just because it's come up a lot in the performance world, whether it's the um, cross country horses or race horses or even dressage horses and show jumpers. I know the Olympics, we've seen some pretty like less than favorable looking top lines on these performance horses. And yeah, branching out into talking about those things has definitely been a little bit of, I guess, a risk, and it hasn't always been the most positively absorbed thing that I've talked about on the internet. But, equine welfare has just has become symbiotic with what I do, and I can't not address those things. I try to keep things light and positive and educational, but there are some times, the way the industry works is what's happening at the top is what trickles down, right? So that paves the way, sets the tone and the path for what's acceptable, and the standards, I guess, if you will. So when you see these things, I don't want to use the word egregious, but I guess in some ways there are things out there that are, especially as of late, that have come out with Olympic riders and trainers and things like that. When you see these egregious, more or less, things that are happening at the top, I mean, it's like, listen, our industry is like, I don't know how to say it without sounding so negative, but like we're gonna be damned if we don't make a change and have the education and speak up for our horses. And that's not to say that we have to eliminate horse sport or that we have to be these crunchy, holistic equestrians, unless you want to be, of course. But um, we have to meet in the middle. Like there has to be this ethical component to things. The horse cannot just be a tool for sport, because if it is, this is the path. We've seen the future, you know?
Mm. Yeah, and I think with people like yourself, we can talk about your wellness academy as well, which links in quite nicely. There is a lot more of this coming out, which is so nice to see as well. I know that the equine ethogram as well, there's been a lot of use
Yeah.
of that within even veterinary fields now. I think here in the UK, we've seen a couple of practices, or more than a couple, actually have the ethogram outside the horse's box with, a checklist of, is it showing
Wow.
this, and this behavior? So like I agree, it's definitely is changing, even though maybe it feels a bit slow for people who have been saying this for many years, but it is nice
Yeah.
to see, despite what's happening in the public eye with these top riders amongst few, like at least it's shifting because people are speaking up.
Yeah. Yeah. No, I agree with you. I do think there's been a tremendous shift, I will say, in the last 2 to 3 years. I mean, which is probably when I started leaning into some of this. And, I really couldn't find a lot of it online. And I think that's why it was just kind of, it felt like a dangerous place to be when I would speak about these things. And I would agree, in the last 2 to 3 years, there's definitely been a shift, particularly with the FEI trying to implement some new standards and some new tools. I mean, is it perfect? Oh, no, absolutely not. But at least it's a step. At least it's a step in the right direction. I mean, it can be frustrating with how slow things are happening, but at least there's something, I mean, it could be going the other way, or it could be nothing happening at all. So I think we have to be, in a way, a little bit grateful that there's something going on. And that the pain ethogram with Dr. Sue Dyson, I mean, that's amazing. And it's just interesting too to look at things from two different perspectives, because, from a practitioner standpoint, seeing the ethogram exist and those educational things getting out there and those lectures and the charts, like, and, anybody within the field would have respect for Dr. Sue Dyson if you knew who she was. And it's just interesting to see it from that perspective, and then hear, some top writers kind of more or less poo that. No, some vet and created this. And it's like, what do you mean some vet? Like, this is a very astounding thing. I mean, the studies have been done, they've taken the time to do this. And that's another thing, the funding isn't there for these types of study. I mean, how amazing would it be if we had an institute or some type of foundation that was solely set up to do, all of these kind of more or less studies or experiments. I know there are some individual one-offs who do self-funded things, but I think it would be great if there was just like a really substantial institute or foundation or something that could come together and could really do it all. That would be amazing, because then you'd have undeniable evidence and proof and studies to really hand them and say, here, this is what's going on. These are the changes we need to make. And it wouldn't be all housed and parented within the same organization, if that makes sense. Because while these kind of governing bodies are great in certain respects, you need more or less rules and laws and those types of regulations. I don't think that they check the box when it comes to true information needed to implement and create more or less those rules, if that makes sense.
Yeah, totally. And like the ethogram and like I said, there's other research out there that's emerging more and more. I think that institute sounds awesome in the ideal world. Hopefully, someone with a lot of money can set this foundation up for us all. Um, but you'd also like I remember when I qualified in the chiropractic field, we didn't do much on behavior. I think there was a small module on behavior. There was gait assessment, static, posture, but there was really not much on one of the most key ways horses communicate that. And I think it's because we rightly said there's not been as much research to come through to teach people, because that's where we base the foundation of. So I'm excited to see that progress quite nicely as well. And hopefully that will filter into a lot more trainings of massage, osteopathy, chiropractic, veterinary, because that's the key thing. What horses show us is their behavior.
Yeah. And a small kind of just touch point when we're speaking about behavior and sort of the lack of knowledge or research surrounding thereof, up until maybe 4-ish years ago, I mean, at the barns that I was in, which weren't nothing barns, it was still heavily believed that that a horse who was cribbing was going to teach its neighbor how to crib. And there was no other knowledge or suggestion around anything or anything about it. It wasn't, hey, is the horse provided forage? Is there something stressful going on in the horse's life? I mean, these are what we call stereotypical, otherwise meaning behaviors that do not exist to perform any function, and they're rarely seen in the wild. So this is a man-made problem that we're seeing, and that we're denying the belief of where it comes from when we don't even have the information about it. Like, I just find that so interesting. Whereas now, where I am in my life and my education, of course, I know where it comes from and kind of how it starts and the risk factors, leading up to it. And it's just interesting that a lot of people will still say, or barns, oh yeah, they're teaching your neighbor how to crib and it's a learned behavior and this, that, and the other. So, and I say that to just give an example of something so small yet so powerful when it's planted as a seed of misinformation, and it's just spreads like wildfire and everybody believes it blindly. And again, that brings us back to education, which is why I'm just so hell bent on educating owners to advocate for your horses, because you don't need to know that much to really put yourself on a good foundational space and good footing to advocate for the animal.
And that actually goes nicely into one of the last two questions I have for you, which is what kind of three practical tips would you want to give to listeners or to the lay horse person out there to get started into better understanding their horse? So I'm talking about the person who's frustrated, overwhelmed, doesn't really know where to turn next, has spent quite a lot of money already from a diagnostics perspective, but they still have a horse that they maybe cannot ride.
Hmm. When you say tips, do you mean sort of places to guide them or next steps, or do you mean
How can they
'cause
better understand their horse? They know something is wrong. I'm almost thinking about the Ainsley of Charlie when she had Charlie, and it was like,
um,
oh, he's got
oh,
desmosis. Okay, he needs to go and box rest. Okay, he's now like a raging bull. I'm exaggerating, he's dangerous to lead, but you got to keep going, give him drugs. But you as a
yeah,
person are dying inside because you're like, I have to deal with this extremely powerful, dangerous, now unpredictable animal that you've basically put in like a torture room.
yeah.
What do I do?
So I don't really have, I wouldn't say three suggestions, because there's really just one suggestion. And the only suggestion I can really say is education. Because had I had an outlet of education or a resource to kind of go to and rely upon, I think it might have slightly change the trajectory of what I did. Maybe it would have helped fast track some things. And, that's more or less why I created the Equine Wellness Academy, which is the educational resource that I've just launched, because I just believe that it's information that you need to know. I mean, it bridges a wide variety of topics. So for just to say something small, an example would be, there's a segment on the distal limb. So learning about the tendons and ligaments in your horse's lower leg and understanding how those function and why they're important. And then in relationship to that, there's a segment on boots and wraps. So when you're going to use leg protection on your horse, what materials might you use? Does your horse even need leg protection? What is its function? What are you protecting against? Is it based on discipline? These are questions that are not always straightforward. You can always find an answer for. You see your neighbor in the barn aisle wearing boots or wraps, so you go ahead and do it too. Or it's just the lesson pony you're on. That's what you've been told to apply, so that's what you do. And you don't think anything else of it. So education and thinking outside of the box and being in a place where you're comfortable to ask questions, I think that's the biggest thing you can do. If you're in a pickle with your horse, you're struggling with your horse, you feel like you don't have answers or you're unheard, or maybe you're in a situation or a barn or a relationship with your trainer or your farrier or whoever that you're just like, it doesn't feel quite as cohesive as you want it to. I mean, you got to pull yourself out of it. You got to find somebody who aligns with you and your horse and who's going to listen to you. And I know as horse people, it's very hard to be sort of like in this hypochondriac state because there's always something wrong with them, right? And in some ways that's unavoidable. But I will say, when you have the education, it kind of stops that flow of anxiety because you're not just asking 100 questions blindly. You're saying, hey, okay, let's go back to the drawing board. Are there patterns in behavior that I've noticed? Where do those stem from? And again, there's a behavior segment within the academy as well. Lessons on basic behavior to more problematic behavior, things like pain memories. So let's say your horse has been in pain or had a problem and you've eradicated the issue, or you believe that you have, and then you see, okay, this horse is still exhibiting this problem. Okay, that could be a pain memory. So what do we do now? So there's lessons on that. And then there's lessons on more basic things like problem behaviors, or what we call stereotypical behaviors, cribbing, weaving, things like that. Where do those come from? How do we mitigate that? Things like basic lifestyle and nutrition, how the horse eats, how much movement and turnout they have in their lives. Those are two huge factors that are going to have a very, very large impact on your horse's behavior and your horse's mental health and their physical health. And those are two things that are hugely, I would say, widely, widely overlooked in many industries and locations across the board.
Mm. Yeah, so it's definitely education, and then also don't be afraid to change your environment for sure.
Yes,
Hear them
yes.
well, oh, this person 2 blocks down has said this and this conflicting with this. And it's the same in any industry in life, even non-horses. It's the first thing people will say if you want to progress or feel better than when you currently are, is change your environment.
Yes, and I will say I do get a lot of personal messages from people, in direct messages saying, from practitioners and just horse people in general, saying, "Hey, how did you navigate being the only one who was bitless or barefoot or forage-based diet, or was really honing in on these ethical things with your horse because they're in an environment where, they're the black sheep?" And unfortunately, I don't have a great answer for that, because in a lot of places you are going to be the black sheep, and you just have to power through until you can get yourself in an environment that's going to, foster your connection with your horse a little bit more. And it's going to be a soft place to land for you, which might not always exist. I mean, I have my horses at home with me now, but that wasn't the case 3 years ago. I mean, I was in a big boarding barn and I very much was the black sheep. I was fortunate to have a place that sort of let me do my own thing at the end, and I wasn't judged for it, and I still had friends, and it was okay. But the barn prior to that, that was the one I spoke about, the incident with Charlie. I mean, that was not a good place for me, and it wasn't a good fit, and it was hard to leave because I had made friends there. I had a community there. But I did what I had to do for my horse, and that was it, you know? So
Mm.
yeah, changing environment can be very powerful. Getting to a place that works for you and your horse. It's may not always be easy, but you got to sever ties if it's not working for you.
Yeah, no, really. I think those are two great practical things that I think everyone can relate to and have definitely been in that situation before. The education one is definitely, I agree with you, at the forefront. So I'd like to know on a personal note, because you've been on such a journey as well, from getting Charlie and then going through all that, and your qualifications, the academy. I think you're doing retreats now as well. I'd love to ask you about the retreats. Before I say that, just what drives you, Ainsley? Like, where does it come from? Like, because I'm guessing we've all had criticism putting ourselves out there online. Do you get anything back? How do you handle it? Do you have, yeah, what keeps you going?
So I would say over the past year, it has been difficult to sort of remain as outspoken in the online space. I There's just been a shift in tone on the internet, and I will say I took a huge step back from Facebook in general because it was just a little bit toxic. Like it just wasn't very healthy, wasn't a healthy place to be. So I've tried to just you know, the horses' well-being has always been at the forefront of my mind. I mean, like you talked about my journey with my personal horses and clients and friends of mine who have had, similar issues and helping them get to good places with their horses, I would say is very rewarding. And every now and then that one, review or inspiring message from somebody randomly messaging me on a day like, hey, you've changed things for me, you've changed things for my horse, whatever the case may be. I mean, that's what keeps me going because even if I help just one person who was as lost as I once was, you know what I mean? Like, then it's worth it because when I tell you I had no resources, I mean, I was searching everywhere for answers and for this untraditional path that didn't exist. So I would say that's what's driven me to do everything that I've done. I mean, from the beginnings of the first ebook I wrote to the first course I launched to the massage tool to now having the academy and the in-person retreats. I mean, that has all been to fulfill a need or answer a question that a person had for their horse. I mean, it wasn't ever selfishly from, well, I want to do this to make money. It was like I was truly problem solving. So I really do it for the horses. And it's really magical to see that connection in real time, at the in-person clinics and retreats and just have that light bulb moment with somebody. And then they go home and they send me an email. I did such and such with my horse and blah, blah. I mean, that's what makes it worth it because the people that do want to learn and are in it for the horse, I mean, that's the best part. So I would say that's the driving factor. That's what keeps pushing me along.
Yeah, that is so lovely to hear you say. And this is just like a side note to, I suppose, any equestrian, because I don't even want to blanket therapists. I'm just speaking with my therapist hat on when I say, when an owner does message you or you get a random text at the end of the day, and you've had a long day driving around and someone says, oh, I just want to let you know that, Charlie feels so much better and, I had this moment and it lights something up in you of just pure love where nothing is more important than that knowing that you were a part of it, knowing that you were a guide, knowing that you were a facilitator, but at the end of the day, the owner still made the choice to take action on it. And that is
Mhm.
such a key shift as well. So yeah, that's really good to know. Do you want to tell us about your retreats? These sound awesome.
Yeah, so the retreats have been going on for a few years, and it's the way that it kind of started. So I've talked about I have my license in massage therapy for humans, and you have to do continuing education to keep that license active every few years. You have to have X amount of in-person hours, and so sometimes you can find like exotic locations to go do these continuing eds at. And so I did, it was a Thai yoga massage course in Costa Rica one year. So you were learning, but you were also at, you were in a yurt and you got to do yoga classes in the morning. And we did some little jungle excursions and a butterfly conservatory. So it was like a holiday, but you were also learning and I was getting my credits. And I thought to myself, well, it's there's workshops and clinics at Barnes all the time, but there's not really something that blends the two where it's like a holiday and learning. So in the horse world. So that's where I kind of got that idea from. And I was like, maybe other people would be interested in doing that too. And, because I really enjoyed that. I think learning is always more fun when you're doing something enjoyable as well. And it beats, cramming everything into 2 days, right? When you're 8 hours of learning. And personally, I don't prefer to learn that way. So these retreats, more or less, are you get to come and learn from me in person, doing hands-on things, and you're also enjoying a nice holiday that involves if you want to ride or, a nice sort of luxury location. So that's what the retreats are. This past retreat, I actually just got back from Colorado. So that was the first domestic retreat that I've done. And we had a great time. It was a great group. I mean, everybody got along. It was amazing. The weather was beautiful. The horses were very well kept. There's a herd of over 200 horses that lived out in, just free terrain, and they were very calm and happy horses. So ethically, it really aligned. And, the horses that we worked on for the retreat were in such great shape for being the age that they were. We specifically there was a 20-year-old horse, a 23-year-old horse, and a 24-year-old horse. And then we also worked on a 7-year-old. And I mean, when I tell you I've never seen that age of horses look this good, I mean, it was amazing. And I think that it's a testament to their lifestyle, living in a herd environment and having that amount of turnout and, living off the land like they do. It was really cool to see that because you would never see that where I live. So it was very neat. But yeah, the retreats are amazing. I'm in conversations right now for some 2026 venues. So that should be solidified within the next couple months. And I'm hoping to do more. At this point, I've just been doing one a year. I'm hoping to bump that up and be able to do a couple a year.
Yeah, definitely. Well, let me know personally. And then when can people find out about this? Is it on your website? Is it your Instagram?
Yeah, so I announce all retreat information to the email list first. It's sort of like a primary VIP situation, and that includes Academy members. So Academy members get kind of first dibs on any workshops, clinics, retreats, any events, or anything in person, specials. They all get access to that information first. And then after that, if it's not full, then I'll go ahead and announce on social media. And you can join the email list through the website, and then the academy obviously is featured on the website as well.
I'll make sure to put all of your links in case anyone wants to go and have a look at it as well. The
Yeah.
closing question that I have for you is, what's one lesson a horse has taught you that you couldn't have learned anywhere else?
Oh, that's a good one. I wasn't prepared for that. Um, Let
Probably.
me think. Um, I don't know that I couldn't have learned it anywhere else, but it's certainly been learned more effectively, I think, than it would have been learned anywhere else. And I would say the two lessons are probably patience and I would probably have to say the second one would be emotional regulation. Those are, I don't think that I'm the most patient person by nature, and I think a lot of people can agree. Horses will test your patience and drive you to be more patient. And for me, hand in hand with that is emotional regulation, because to be impatient and aggressive and, show up in a heightened state really doesn't get you anywhere with a horse. I mean, nowhere effectively, anyways, without causing trauma. So I think those have been huge lessons. And I think my rescue horse, Sherman, he's a big Belgian draft. He's the size of a small elephant. Yeah, so patience and emotional regulation for both Charlie and him, but particularly Sherman, because you're not making that horse do anything. So you've got
Size.
to, yeah, so you're not cutting corners, you're doing things the right way, you're gaining trust in, a sustainable way with that horse. And I think sometimes with horses who maybe aren't as big or aren't as aware of themselves, it might be easier to sort of fast track and break those walls down. I think that when you challenge a horse in that way, either two things can happen. They become very stoic and shut down, or they become explosive and perhaps dangerous. So yeah, I mean, I don't believe in cutting corners at this point in the game. It doesn't get you anywhere.
No, those are two answers that minute you said them, I was like, yep, she has summed me up totally.
Yeah.
There's no way, we all know this, you cannot lie to a horse. And I don't mean that we're deceiving people, but I just mean, if someone asks you if you're fine, you're like, yeah, I'm fine. You can almost brush it off. But if you take that state into the horse that you want to go and work and ask a question and you're like, come across quite impatient, a little bit, frustrated, straight away they're going to be like, whoa, I'm not getting involved in that.
Yes.
You know
Well,
what I
that's absolutely right. Because I mean, I've done it, because I've done it. There have been many times where I've showed up for a session or a ride or whatever it is, and I, wasn't in that space, and the horse knows it, and it's almost never going to work out for you in a great way if that's how you're showing up. So yeah, I would say those are the two lessons that most effectively have been taught through the horse.
Yeah, I really think we can actually deep dive into that in another episode, maybe in the future, because there's a big link. Even as a therapist, I found that when I am more aware of my state, emotional state, and can regulate that before I go in or even between sessions, my sessions are better. So I know as a therapist, it changed the game for me, even working with horses or expecting to work with other people's horses as well. But yeah,
Yeah.
just want
Yeah,
to say thank
definitely.
you really very much for your time and for joining us today.
Yes, thank you. This is a great conversation. I'm so happy that you had me and happy to chat more in the future about anything we've talked about. Yeah, the life lessons learned by the horse could definitely be a super long topic, I feel. So
So many stories. Thank you.